Depression is not just about feeling sad for a few days. It is a serious mental health condition that affects the way people think, feel, and live their daily lives. While almost everyone experiences sadness, stress, or grief at some point, there are individuals who fall into a much deeper state of depression, one that feels overwhelming, heavy, and seemingly endless. Understanding why this happens and what can be done is essential, not only for those who suffer but also for the people around them. One major reason for excessive depression is biological and genetic factors. The human brain relies on chemical messengers called neurotransmitters to regulate mood and emotions. When there is an imbalance, such as low levels of serotonin, dopamine, or norepinephrine, the brain struggles to maintain emotional stability. In some families, depression runs across generations, suggesting that genetic predisposition plays a role. This does not mean depression is destined, but it shows that some people are more vulnerable. Another strong factor is psychological history and trauma. People who experience childhood abuse, neglect, bullying, or loss of loved ones often carry unresolved pain into adulthood. These painful memories can leave scars in the brain and nervous system, making them more likely to fall into deep depressive states when faced with stress. Third, we must consider social and environmental factors. Loneliness, poverty, job stress, unhealthy relationships, and lack of support can push the mind into despair. Modern life, with its constant pressure to succeed and the unrealistic comparisons created by social media, also adds weight. Someone who feels they can never measure up may spiral into hopelessness. Excessive depression is also linked to physical health conditions. Chronic illnesses like diabetes, cancer, or thyroid disorders can affect hormones and brain chemistry, making depression worse. Even lifestyle factors such as lack of sleep, poor diet, or substance abuse can intensify the problem. So how can it be managed? The first step is acknowledgement. Many people hide their depression because they fear judgment, but acceptance opens the door to healing. Seeking professional help is critical. Therapies like cognitive behavioral therapy, CBT, and psychodynamic therapy help individuals identify negative thought patterns and gradually replace them with healthier ones. Medication can also play a vital role. Antidepressants such as SSRIs or SNRIs work by balancing neurotransmitters in the brain, reducing the intensity of depressive symptoms. However, they are most effective when combined with therapy and lifestyle adjustments. Speaking of lifestyle, daily habits have enormous power. Exercise is known as a natural antidepressant because it releases endorphins that elevate mood. Mindfulness meditation helps calm the restless mind and create inner balance. Building healthy sleep routines and limiting alcohol or caffeine intake also significantly reduce depressive episodes. Another crucial factor is social support. Talking with friends, joining support groups, or even sharing feelings with family can create a sense of connection that protects against deep depression. Sometimes just knowing that someone listens without judgment can lighten the emotional load. Lastly, self-compassion is essential. Many people with depression criticize themselves harshly for not being strong enough. But depression is not a weakness, it is an illness, just like any other health condition. Healing requires patience, kindness toward oneself, and the courage to ask for help when needed. In conclusion, excessive depression arises from a mix of biology, psychology, and environment. It is not the result of laziness or weakness. With the right combination of therapy, medication, healthy lifestyle choices, and supportive relationships, it is possible not only to manage but to recover and live a fulfilling life. The journey may be long, but every step toward healing is proof of strength.